Hello, my name is Courtney Colvin, and this is the recording for the Critical Competency Exam. This is my volunteer, Dawn, and we'll go ahead and begin. When I prepare to do an exam, I'll need to gather all my necessary equipment and go to the room. Introduce myself. Hello, Dawn. My name is Courtney. I'll be your nurse today. I'm going to be performing an exam on you, so we'll be listening to your lungs, your heart, your stomach. I will have to touch you during certain parts of the exam, but I'll make sure to let you know what I'm doing. Do you have any questions? No. Okay. I'm going to make sure to wash my hands before I begin, and we'll go ahead and start. So, at the beginning, I'm going to assess Dawn's mental status. So, I'm going to ask her questions regarding time, person, and place. Dawn, do you know about what time of the day it is?
Afternoon.
Correct. Do you know where you're at?
My home.
Correct. And do you know your name?
Dawn.
Can you tell me your date of birth?
11/30/57.
Correct. And I can check that against her medical records. So we're going to go ahead and just start inspecting Dawn's skin and nails. So I'm just going to pull this down so I can just take a better look at you. And and I'm going to raise where I can look at your legs too. Dawn's skin color and condition is fair. Uh, she's pink. It is congruent with her race. She is Caucasian. And I'm going to assess your skin turgor. So I'm just going to pinch up the skin on the back of your hand. And good. It has good elasticity. And I'll do that on the other. And also below the collarbone. Good. This shows that she's not dehydrated. She has really good skin turgor. I'm going to go ahead and check your capillary refill if I can see one of your fingers. Good. Capillary refill with less than 3 seconds on both, and then I can do this on her toenails as well. All right. And I'm going to use the backs of my hands to assess your skin temperature. Okay? So I'm going to ask you to put your hands out flat. And I'm doing the fronts and the backs. Now can you put your arms out? Assessing the anterior and posterior. Now I'm going to assess the skin temperature of the legs. And this is warm bilaterally, anterior and posteriorly. Can I ask you to just bend at the knee so I can assess the temperature on the backs of the legs? And she is warm. You can go ahead and relax. I see no pallor or jaundice anywhere. Let me take a look at your stomach too. All right. And she is a little lighter on the stomach. This is just because that area gets less sun exposure. I see no lesions, scars, or markings on Dawn. No open wounds or anything like that. So after we assess her skin and nails, we can go ahead and move on to the eyes. And I'm going to assess her eyes using Perla. So I'm going to make sure that the pupils are equal, round, reactive to light, and accommodation. So with my pen light, I'm just going to shine this in her eyes. Dawn, I'm going to just shine this light over one of your eyes and then the other. And you don't have to do anything right now, just follow the light. Her pupils are about 3 millimeters approximately, and they're both equal in size, round in shape, and they both reacted to light the same. They both constricted, and when the light is taken off of the eyes, the pupils go back to their normal size. They constricted down to about 2 millimeters whenever the light was shown in the eyes. I'm going to ask you to just follow the object, okay? And they do accommodate to a close object. So that's going from far away, closer to the body of about around 3 inches. Follow the pen light with both eyes, but don't move your head. Good job. All right. Next, what we're going to do is assess her mucous membranes. So, Dawn, I'm going to ask you to open your eye. I'm actually going to use my pen light again so I can see good. Lift your tongue. I'm looking in the inside of the cheeks, buccal mucosa. All right, use your fingers so I can see your lip and your top lip. All right, mucous membranes are pink and moist, and I don't see any lesions or wounds inside the mouth. So she has healthy mucous membranes. Next, I'm going to go ahead and look at her pinna. So look at her ears, excuse me. So Dawn, I'm going to ask you to sit up. All right. And so you can better be able to see what I'm going to be doing. I'm just going to pull up on the pinna and back, and I'm going to insert the otoscope, and I'm inserting it almost towards the patient's nose so I can visualize the tympanic membrane. And the tympanic membrane does appear pearly gray, and then I can do that on the other ear as well. Dawn, can you turn your head? So I'm going to pull the pinna up and back, insert the otoscope, and I'm going to visualize the tympanic membrane. And if we wanted to assess the ears further, we could do the whisper test. And Dawn does have enhanced hearing in her left ear because she had surgery to fix partial deafness. All right, so after we assess her ears, we can go ahead and move on to the peripheral vascular system. And so with this, we're going to assess her radial pulses, and we're going to do this symmetrically, bilaterally, so at the same time. And grading on a scale of 0 to 4, I'm going to grade them at +3. They are very palpable. She has a strong, good pulse. Next, what I'm going to do is I'm going to assess her posterior tibial pulses, and these are on her feet. So Dawn, if you could sit up so the camera can see your feet, and aim your feet this way. Bend your knees so the camera can see. Okay, so this is just on the top of the foot. I'm going to do this at the same time. Bilaterally, they are about a 3 on the grading scale of 0 to 4. While we have her like this, we can go ahead and we can assess for any tibial edema. And so what I'm going to do is just press on the legs, and I don't see any sign of edema. If we want to assess for pitting edema, we could also do press on the feet and release, and we see that she has no presence of any edema. All right, Dawn, you can go ahead and lay back. So after the peripheral vascular system, we're going to go ahead and assess her heart. So what we're going to do is, while Dawn is supine, I can go ahead and listen to her, and then we can do so sitting up as well. And we're going to listen to the different areas of the heart with our bell and our stethoscope. And so first, what we're going to do is see if we can visually assess any heaves or thrills. So I can stoop or bend down, and I could lift the sport top that Dawn is wearing, and I don't see any visual heaves or thrills, or lifts. So we can go ahead and auscultate Dawn's heart, the heart sounds. And I'm just listening for the S1 and S2, making sure that I don't hear a presence of any murmurs or gallops or any abnormal heart sounds. All right, and at this time we can go ahead and also listen to Dawn's apical heart rate, and we're going to do this for 1 full minute. So with a watch, using the second hand, and we can go ahead and do that at this time. I listened for 15 seconds. I listened to her heart for 15 seconds, and we can multiply that by 4. I also listened to her heart before we started this, and she averages around 70 to 72 beats per minute, and the normal is 60 to 100. Dawn, I'm going to ask you to sit up so the camera can see what heart sounds we're listening to. Go ahead and put your feet on the edge of the bed and sit to the edge. And I'll just pull this forward. All right. Okay. So I'm going to go ahead. Hopefully you can visualize that really well. And I'm going to locate the areas where we're going to be listening to the heart. So I can go ahead and listen to those areas with the bell since I've already listened with the stethoscope. Sorry, I'm trying to get in the camera. Okay, so on the patient's right side at the second intercostal space, we're going to listen to the aortic area. And then the second intercostal space on the left side is the pulmonic area. And then the third intercostal space is Erb's point. And then the fifth intercostal space, left lower sternal border, is the tricuspid area. And then at the fifth intercostal space, mid-clavicular line on the left side is the mitral area. And so I'm going to listen to all these areas of the heart now with the bell since I've listened with the stethoscope. You don't have to. I'm going to lift this so I can hear. All right. And once again, I did not hear any abnormal heart sounds. Her heart sounds like it is in normal sinus rhythm, and that's what we want. That's wonderful. Okay. Now what we can do is go ahead and assess Dawn's, sorry, I want to make sure I can be in the camera. I'm going to go ahead and assess Dawn's thoracic, or excuse me, I'm going to go ahead and assess her lung sounds. And so at this time, first we're going to assess the skin and the condition of her chest and her thorax area. So where we will be listening, Dawn's a little modest, so that's why we're giving her this little blanket here to stay covered. So what we're going to do, here we go. What we're going to do is first just assess the skin anterior and posteriorly. I see no lesions, no markings, no scars. Her skin color and condition is congruent with the assessment of the skin prior. She is Caucasian. I see no markings or irregularities. So what we're going to do is assess for thoracic cage expansion and symmetry. So just from looking at Dawn, we can tell that she is symmetrical, and then we can go ahead and look at the back, and her thoracic cage does appear symmetric. So we can go ahead and perform the thoracic cage expansion. So what I'm going to do is take my hands and just ask her to breathe in and out. Okay, Dawn, breathe in and out. Breathe in and out. And if you see, my hands kind of open up her thoracic cages as she takes, as she is inspiring, and then as she expires. Okay. And then I'm going to do the same thing on her back. Dawn, if you can maybe turn with your legs up here on the bed so they can see me. Okay, so I'm just going to do the same thing. Breathe in, out, breathe in, Out. Good. And the same thing on this, on her posterior. She has thoracic cage expansion that is symmetric posterior, and so that is good. That's what we want. Um, Now what we're going to do is we're going to go ahead and listen for lung sounds. We want to listen for the presence of any adventitious lung sounds such as wheezes, rails, or rhonchi. And we can go ahead and count her respirations per minute without her knowing, also when we were taking her pulse. So I'm going to come around, and Dawn, just hang your feet off the edge of the bed like you were doing earlier. And I will need to see your stomach. Okay. So we're going to go ahead. And I'm going to listen in about 8 or 10 spaces on her chest so we can listen to the lung sounds. And just take a good, just breathe in and out every time that I move my stethoscope, okay? I'm now listening with the diaphragm. Okay, breathe in. Thank you. Yeah. And I'm also going to listen to the right side of Dawn too. Breathe in. Okay. All right. I heard no adventitious lung sounds, only clear lung sounds over all the lung fields. We did listen to the right upper, right middle, right lower lobes, and then the left upper and left lower lobes. I'm going to do the same assessment, listening to the lung sounds on Dawn's back. So, Dawn, if I can ask you to get in that same position, but just turn around with your legs on that side. All right. And Dawn did have clear lung sounds. So that's perfect. I heard no adventitious sounds such as wheezes, rhonchi, or rails, or any of that on Dawn's posterior. All right. Once again, we can still assess Dawn's skin and as we're doing the entire assessment. So, and I still have not seen any kind of marks or scarring or any lesions. Okay, Dawn, you can go ahead and lay back flat with your head not on the pillow. So lean down. And then we'll just put a small part of the pillow under her head. And we're going to listen to your abdomen. You can use that for modesty. I'm going to shine this down on Dawn's abdomen where you can visualize that really well. And I'm going to stand on Dawn's right side. Okay. So first, what I'm going to do whenever I am listening to Dawn's bowel sounds, before I begin that, I'm just going to visualize Dawn's abdomen. I don't see any lesions. I only see a couple scars, and from her health history, we know she had a surgery, and that's what those scars are from about 23 years ago. Um, and I can do this visualizing from like a stooped position or standing above her, and this helps to see any masses or any irregularities. Um, I'm going to look for any pulsations of the abdomen, and I don't see any visual pulsations. The only way we're going to be able to tell if she has normal peristalsis is to be listening for the bowel sounds. Um, so, and this is similar back to when we were listening to the heart. You were seeing if you could visualize in this area any pulsations. So, same thing, we're not able to visualize that. So, I'm going to go ahead and listen to Dawn's bowel sounds. And I'm going to do that starting at Dawn's right lower, right upper, left lower. I'm going to listen with the diaphragm. Bowel sound. Bowel sound. Ooh, bowel sound. And bowel sound. And the bowel sounds are like clicks or gurgles, and they are irregular. They're not always going to sound the same. They should occur 5 to 35 times in 1 minute. If you have less than 5 times in a minute, that would be hypo. Greater than 35, hyper. But this patient, my volunteer Dawn, has normal active bowel sounds. Is there any tenderness or pain in your stomach?
No.
Okay. We can ask her more about her daily bowel habits if we wanted to get more information. If we wanted to state that she had absent bowel sounds, we need to listen for 5 full minutes to the entire abdomen. So now what I'm going to do is perform light palpation of the abdomen. And I'm going to do this standing at Dawn's right side. And I'm going to position the camera again so you can see. All right. Okay. And sorry, my head kind of gets cut out of the film here. I'm trying to get the camera up close so you can see her abdomen. With light palpation, I'm going to be using just one hand. I'm going to be using my dominant hand. And I'm just going to be kind of going in a circular motion and then lifting my hand and moving over just a few inches. We're only going to go about 1 to 2 centimeters on the light palpation. And I'm going to be assessing for any muscle guarding or tenderness during this exam. Dawn, if you have any tenderness or pain, make sure to please tell me.
Okay.
All right. Any tenderness there?
No.
Any tenderness there?
No.
Still no pain?
No.
Okay.
No.
All right. And Dawn reported no discomfort or pain. I saw no facial grimacing, so I know that she is experiencing no acute pain. What we can do to further the assessment is perform deep palpation. So with this, we're going to use 2 hands, and one hand will be used on top of the other, and we're going to just press a little further, more like 4 to 5 centimeters, and we're going to be assessing for enlargement of any organs, organomegaly. We're going to be assessing for once again, any masses or tenderness or pain, and also if the patient has any kind of muscle guarding. So if we see her tense up. All right. Dawn, if you have any pain or tenderness, just tell me. Any pain, tenderness?
No.
All right. We can go ahead and palpate her major organs in her abdomen, which are the spleen and the liver, also the kidneys. But from my deep palpation, I would be able to kind of get an idea if she did have any enlargement in her organs. Um, and from my deep palpation, I did not gather that. Um, so we could go further at this time if we wanted to and palpate those organs. Um, so at this time, what we're going to be doing is assessing Dawn's musculoskeletal system. And so for this, Dawn, I'm going to ask you to grip my hands as tight as you can. Good job. And on a scale, I would grade that about a 4. She has a really good, strong hand grip. We can also go ahead and assess for Dawn's plantar flexion. So what we're going to do is I'm going to move the screen back so you can see her feet. So Dawn, go ahead and sit up on the edge of the bed with your feet in view of the camera. I'll move this back. You can go ahead and hang them off. Okay. And plantar flexion, I'll show you with my foot. You're just going to point your toe down and just bear against me. Okay? And the other foot? Good. I would rate that about a 4. She has a really good, strong reflex when she was going against the pressure of my hand. I'm also going to assess for any skeletal deformities at this time. And you can do this earlier when you're assessing the heart and the lungs when you're actually looking at their chest and their back. I'm going to ask her to stand up and bend over, and then I'm going to look at her from the side, the front, and the back. Okay. And so, looking at Dawn's spine here, I don't see any skeletal deformities. Go ahead and stand up. She is symmetrical. All right. Good. And I can go ahead and see if she has any tenderness of the spine and also the areas around the spine. So face your back to the camera and just tell me if you have any tenderness or pain.
No.
Any pain there?
No.
There?
No. No.
Okay. And we're looking for any pain or discomfort or tenderness, and that would indicate a problem we need to look further into. So after we have performed that, we know that we have kind of gone over a whole multiple different body systems, and this is more like just a quick, you can go ahead and sit down. This is just a quick way to go through and kind of head to toe look at everything. So that concludes the CCE video. Thank you.